My name is Fran Rothwell. I'm an associate solicitor in the medical negligence team at Boys Turner. We are cancer negligence specialists and work with many people who are sadly impacted by delays in diagnosis of cervical cancer. And we understand the difficulties that are faced by them and by their loved ones, who provide a great deal of care, assistance and support. So I'm very happy today to be joined by Dan Joyce of Jos Trust. Jos Trust is the leading cervical cancer charity in the UK and work tirelessly to bring a great deal of knowledge about the disease. So hi Dan, I was wondering if you could just introduce yourself and let me know a little bit about the charity.
Hi, Fran. Yeah, thanks for having me. So I'm Dan Joyce. I'm the head of fundraising at Jos, and I've been with the charity since 2017. As you mentioned, we're the UK's leading cervical cancer charity, and we were founded in 1999 by James Maxwell. We were founded after his wife Jo passed away from cervical cancer, and they felt they couldn't get access to reliable or the best information possible. His vision was to create a charity that would do that nationally. And 20 years on, here we are, still providing support for thousands of people each year. So in terms of cervical cancer, over 3,000 people a year are diagnosed with cervical cancer, but with cervical cell changes, which may lead to, may need treatment because they may lead to cancer. There's about 220,000 people each year that are diagnosed with cell changes. So we provide support and information for all those people through our online channels. And also we campaign for changes in policy and to improve care of those that have been diagnosed with cancer as well. The services we provide have a helpline that people can ring, and we provide a callback service that we might do after people or just before people go to their appointments. We have an Ask the Expert scheme where you can submit a question and we'll put it to our expert panelists to provide an answer to save time going to and from doctors. And we have an email service, and also we run face-to-face events, which obviously have not been part and parcel this year, unfortunately.
Yeah. So in terms of the support that I'm thinking for people who are contacting the charity, what kind of things do they tend to be struggling with, and how can Jos help them with those things kind of specifically?
So predominantly through our helpline, we're seeing a lot of calls around HPV and health anxiety. And so our helpline is fully trained, and there's a refresher once a year as well for those helpliners, so they can make sure that they're giving the most up-to-date, the most accurate information, and they're providing the support that is needed to those people. The UK has now changed, or other than Northern Ireland, has changed over to HPV primary testing, which means more and more people are being told they're HPV positive, and potentially need further investigation on their screening results. So there's a huge misunderstanding, or I think some myths around HPV and what causes of it, where it comes from. And so we're trying to tackle quite a lot of that stigma at the moment. We released some research around HPV last year, which got some really good traction, and people are starting to get a bit more of an understanding of it, but there's still a long, long way to go. Obviously, health anxiety is very high at the moment, with coronavirus obviously impacting services, people's appointments being delayed. Some people might be on 1 year recalls for screening, so they've had an abnormal smear test previously, so they get called back each 12 months, and some of those may be cancelled or postponed, which is obviously leading to more anxiety, because those people have had experiences in the past where the results have not been clear or haven't been as expected. So we provide that direct support for people. They can call straight through to our helpline. They can access our email service. They can get instant support as well from us, just to try and answer any of their concerns or queries.
That's brilliant, because I know that your helpline staff all have experience of cervical cancer, don't they, as you said, and extensive training, so they really are best placed to kind of provide that support for people.
Yeah, some are professionals, so healthcare professionals who work maybe gynecology, so they have direct experience, and others are people that have been affected by cervical cancer diagnosis themselves. So in terms of the support they can offer, it's really quite intimate, and it's quite personal to them as well to support the cause, which is obviously means people get supported really, really well.
Absolutely. And actually touching on, of course, you mentioned HPV and unfortunately the stigma, which absolutely, completely support any work to get rid of that. I don't know if you'd be able to speak a little bit about kind of some of the myths you've heard about HPV, and then kind of a little bit of reassurance for people and some kind of information about that.
So we actually, at one of our outreach events, so we have outreach officers that work in parts of the UK, someone asked the question if they could get HPV could their dog transmit HPV? So it's really interesting. There's a huge misunderstanding, even to the point of where it's now HPV, people not opening letters because they're scared of HPV, of what it might mean. There's sometimes a mix up of HPV and HIV. So there's a real complete misunderstanding there. What we're trying to do in terms of tackling the stigma is raise awareness of what HPV is, talk about the vaccinations that happen at school age as well. So there is a HPV vaccine which protects at the moment about 70% of HPV strains. So we encourage people obviously to learn more about the vaccine and look into that, and obviously speak to their children about getting that vaccine when they're at school. But we also talk about the importance of still having that screening when you're eligible, when you turn 25, because yes, there's 70% vaccine against HPV strains, but there are still those high risk factors in the other 30% that people could be getting picked up in screening. So I think HPV, it's quite complex because there is a vaccine for it. People often say, well, I've been vaccinated, so actually I don't necessarily need to go for screening. So that's one of the biggest challenges for us, is to encourage people still to go for screening if they feel it's right for them.
Yeah.
So for some women, it can be painful, particularly if they're experiencing menopause, it can be painful. And we do always say that every experience is individual. So some people may find it's really not an issue at all, but we've done quite a lot of work with Rape Crisis, for example, to talk about survivors of sexual violence and how that might impact them, people with psychosexual issues that need extra support. So we've provided a whole range of information in collaboration with Rape Crisis to talk about that and how we can help and how Rape Crisis can help people still want to access screening services, even though it might sort of bring back trauma. So that's obviously quite a niche but a really important piece of work. So that's one facet of it. And we talk about in our campaign weeks, actually, we would never say you have to go to screen, you have to do this. Everyone needs to look at their life and make their decision based on what's best for them. And pre-coronavirus, we'd always say if it's helpful, take someone with you to an appointment, friend, family member, whichever makes it easier. And we have mini guides as well to talk about what screening is, what to expect when you go to hospital. Obviously now with coronavirus, you can't take someone with you to an appointment at the moment. And actually the appointments do look quite different. Everyone's in so much PPE that it's almost, you have no rapport with someone who's dressed fully in PPE, so that makes it quite difficult as well. It's not very personable. So, and you're going for quite an invasive procedure for some people. So that does make it quite difficult as well.
Yeah, no, I understand that. You mentioned your campaign weeks. I don't know if you could give us a little bit of information in terms of exactly, kind of what kind of fundraising opportunities there are perhaps during that, what you do, who you're in touch with and when they are.
Yeah, so we have two main campaign weeks throughout the year. So January is our cervical cancer prevention week, and we'll talk all about the best ways to prevent cervical cancer. In 2021, we're going to have a big focus on HPV. As I mentioned, that's our big area for improving public knowledge. So we'll engage with members of the public, obviously women of screening age, healthcare professionals across all parts of the UK, just to talk about what HPV is, what it means, the best ways to prevent cervical cancer, HPV vaccination, what that is, and the current uptakes of that, and what increasing or decreasing those uptakes does to cervical cancer incidence in the future. Our second campaign week is in June, and that's Cervical Screening Awareness Week. So that week is quite heavily focused towards healthcare professionals, because we'll talk a lot about screening, the best way to support their local communities, to learn more about screening and how to get people involved. And that week, we run an event called Steps for Jos. So it's gone to a virtual event this year. It used to be held at the Olympic Park, but I think going forward it will be a virtual event, so more people can get involved. And we ask people to run or walk 5 or 10K on a certain day within June, if they can do that, or not, then it can be any day within June, and try to raise £100 to support the work of Jos Cervical Cancer Trust.
Fantastic, that's great. And that kind of touches on, because I was going to ask as well, how the pandemic has really impacted Jos Trust. You picked up there, events which would have been in person, you can some of them can be virtual, which is great. People can still get involved. I don't know if you could speak a little bit about that, how things perhaps have changed, and how you're still able to carry on supporting people.
Yeah, so obviously in March, we saw a huge drop in income for the rest of 2020. About £600,000 in challenge events was lost throughout the year through cancellations and postponements. And for a charity that brings in raises between 1.6 and 1.8 million pounds, that was a huge chunk of money to almost lose overnight. So brings huge challenges with it. Had to adapt quite quickly. But in terms of the support we can offer and how we do that virtually, we adapted because of our support services. A lot of them are online or mobile, so that's quite straightforward. But our face-to-face event, where we meet people that have been affected by cervical cancer, couldn't go ahead as usual, and that's obviously that's a really important week for us, or weekend it normally is. But we turned it into a week where people could join Zoom sessions, which would talk about anything from mental health, living with cervical cancer or going through treatment, sex and intimacy, post-treatment, session for partners as well, to talk about their concerns, how they've been impacted by their partner's treatment. So we managed to run that online, and we had, I think, over 90 sign-ups throughout the week for that. And we'd normally see about 75 to 90 for our face-to-face events. We still managed to support the same number of people throughout that week as we would have otherwise, which was fantastic. It was really great to see. It was obviously quite a shift in how things were run, but all the feedback, I think over 95% of people said that they would recommend it to a friend or someone that had cervical cancer. So it was really successful, but again, a real shift in how we focused our support.
Yeah, it's fantastic that you're still, people can still be involved. And as you said, the numbers, as they were, I think it's about doing things differently at the moment, isn't it? But that doesn't mean that, there isn't a fantastic amount of work that can be done, and a fantastic amount of support that can be given. So that's really great.
Yeah, we just had to think on our feet a little bit and move quite quickly and change how we always deliver our services and support. And we actually managed to stay open throughout the pandemic. So our helpline was consistently open. Our RC expert service, even though it does involve NHS staff, still was being run. It was a bit quieter, but actually it still managed to run as usual as well, which was fantastic.
Yeah, that's really great to hear. Thank you very much, Dan. I think that was all the questions I had for you. Thank you for joining us and for the great work that all of you at Jos do. I hope to speak to you soon.
Thank you very much, Fran.